everyone, to Catalista's 2 Minutes to Midnight, The Future of Work. My name is Ed Goldberg, coming to you from the studios at Catalista Centrale. "2 Minutes to Midnight" connects the dots between capitalism, democracy, and rapidly accelerating technology. We're using a book as our through line for the series, and the book is People Get Ready: The Fight Against a Jobless Economy and a Citizenless Democracy. The book is by Robert McChesney and John Nichols. 2M2M, The Future of Work, looks at specific fields and topics that impact everyone. In this episode, we'll look at the future of healthcare. Gerard Brogan is the Director of Nursing Practice for the California Nurses Association, a branch of National Nurses United. With more than 175,000 members nationwide, the NNU is the largest union and professional association of registered nurses in United States history. NNU advocates for guaranteed health care and negotiates many of the best collective bargaining contracts for RNs in the nation. Gerard, what does the future of nursing look like if the current neoliberal capitalist system continues on its current trajectory?
I'm glad you mentioned the word capitalism, because we're seeing much more venture capitalism entering into the healthcare arena. And of course, what they're looking for, the venture capitalists, is to squeeze, I'm using their vernacular, not ours, inefficiencies out of the system. And those inefficiencies, one of which would be labor costs. So if the venture capitalists have their way, then the future of nursing is pretty bleak. But there is an alternative to that, and that's nurse power, which we feel the National Nurses United organization, wield very effectively. So very disparate futures laid out there. Sad to report. Some other nursing organizations, certainly more conservative than us, have bought into this future of nursing where it would be, and this is their vision laid out somewhat succinctly, is we'd have super nurses. There would be master's degree nurses supervising unlicensed assisted personnel and robots by the bedside. That we're seeing more and more robot nurse aides and robot nurse helpers come into the profession. But we have an entirely different vision. So we're trying to shift that power paradigm, build political power within the nursing world, within the whole healthcare world. There are 22 million nurses across the world. That's the latest estimates we can find. About 2016, we started a group called Global Nurses United. We've been a pretty powerful organization. We've got some political heft and certainly some influence, both in terms of just the general debate about healthcare itself and legislation.
If you've listened to Catalista's The Beautiful Work Challenge on birth, you'll know the renowned birth anthropologist Robbie Davis-Floyd. You'll also probably have a sense of the deep influence the process of birth has on us as individuals and as a society, present and future. Robbie, would you start by telling us about the work you do?
I am a cultural/medical/reproductive anthropologist. I've been studying childbirth, midwifery, and obstetrics since about 1983, and reproduction. I've written several books and co-edited or lead edited, did like 16 collections. I have been driven by my passion this whole time because it kind of breaks my heart to know that at this very moment around the world, billions of women are giving birth in ways that are completely inappropriate and wrong. Medical interventions are being used in ways that harm the birth process and make it harder and much more painful and miserable for women. These procedures are not evidence-based, and women are suffering and they're being abused. Obstetric violence is happening all over the world, and the global cesarean rate has gone up to 1 in 5 globally, and that includes the whole world. Even, so there are countries with cesarean rates, like in sub-Saharan Africa, that are below 5%. And women are dying from lack of cesareans. But in most high-resource countries, cesareans are done at rates of, in the U.S. it's 32%, in Brazil it's 56%. And so above 15%, cesareans cease to have any value in terms of preventing mortality. And most of the cesareans done in the US and other countries are for failure to progress. And what's ironic is that you're not actually in labor until you're at 6 centimeters. Labor is 1 to 6 centimeters, and that can safely take hours or days. And active labor starts at 6 centimeters. So when you have a cesarean for failure to progress and you're only 4 centimeters dilated, you were failing to progress. You weren't even in labor. You were failing at something you weren't even yet doing. And failure to progress accounts for most of the cesareans in the US and elsewhere. So it's a global tragedy. And when I think about it too much, it makes me too sad. So I try to help with my writings and my teachings and my presentations. But it is a global tragedy that not enough people are paying attention to.
Is there a connection between technology and hospital profits?
Hospital birth is hugely profitable for hospitals. And our obstetric system, even though all the routine interventions performed on laboring women, like inducing labor, augmenting, speeding labor up with Pitocin, using the electronic fetal monitor, having women lie flat on their backs. None of those are evidence-based, but they all make the hospitals a lot of money, especially using the monitor. But the thing is that those procedures, I call them rituals. I think they're rituals that enact the core values of the technocracy. And those rituals make doctors feel safe because as long as they're surveilling and managing birth technologically, they feel like they have control of it. They also make women feel safe. That's why most women choose to go to the hospital, because they feel safer there. They feel like the technology will keep them safe, when in fact the technology makes birth more dangerous and causes more harm. Sure, most babies are born alive and healthy, but many mothers are traumatized by their hospital birth experiences because there's so many interventions are thrown at them, and often there's obstetric violence, disrespect, and abuse. So that whole system needs to go out the window, and birth needs to become humanized and again, decentralized.
Gerard, would you talk about a few of the major challenges that face nursing in today's neoliberal landscape?
We're constantly building power and pushing back against the capitalization of healthcare. The seeds of that were President Bill Clinton. He gave his wife, Hillary Clinton, the job of reforming healthcare. It failed. He put his hands up in the air. He went on national TV and said, well, we tried to reform healthcare. We failed. So let the market decide. Any clinician in the country, the United States, could testify to the major difference prior to that speech and then post following that speech. This is where we really saw capital coming into healthcare. Massive corporations like the HCA, Tenet Healthcare. So they're absolutely for profit and, unashamedly emblazon that in all they do. But we're seeing non-profits such as Kaiser, Sutter. These are major players on the West Coast with plans to not just expand right across the USA, but literally across the world. We're seeing them emulating those same cost-cutting measures. So what we're seeing is the dehumanization of healthcare, where everything is run by actuaries. They know that if they cut staff into the bone, if they don't have these kind of adequate supplies, which we've seen stark illustration of that during the COVID pandemic. And again, this is absolutely related to the industrialization of healthcare, whereby they've adopted industrial processes such as the Toyota lean model, just-in-time staffing, just-in-time equipment and protective gear, procurement.
Robbie, could you talk about a few elements in the field of birth that really need to be transformed?
The answer requires a vast increase in the number of community midwives, requires a decentralization of birth and the funding of multiple smaller birth centers and clinics all around the country. Tertiary care hospitals should be reserved only for those cases that really need them. As the climate crisis progresses, we're going to see more pandemics and a lot of disasters. We don't even call them natural disasters anymore because they're man-made mostly. And so there's going to be a lot more crises, and hospitals get overwhelmed. They get destroyed in earthquakes. And so if birth were decentralized, if there were these nodes of birth attendants in every town and city, multiple ones in cities that are decentralized, that are in communities. And if most births took place in those, that's a much more flexible and ecological model. Hospitals are carbon intensive. They throw away tons and tons of trash, and they perform dozens of unnecessary interventions that require high technology in the birth process. Davis, Anderson, and Johnson recently did a comprehensive study, and they figured out that if only 10% more births in the U.S. took place at home and in birth centers, only 10%, we would save $11 billion a year in hospital costs. It's incredible. The thing is that women don't care because they're not paying. Their insurance is paying usually. So who would those cost savings go to? You get 10% rise in freestanding birth centers and home births, and then the insurance companies are now not paying for that many more interventions. And so the savings ultimately get passed to the consumer because then they can charge lower premiums and consumers benefit. And it's so simple. Just 10% more saves $11 billion a year. We spend more on healthcare and more on maternity care than any other nation, and yet our outcomes are not great. We have the highest maternal mortality rate among high-resource countries. And so that's my solution: decentralize birth care and get those midwives out there, educate more midwives and integrate them. The midwives who attend, most of the midwives who attend births are CPMs, certified professional midwives. They're highly skilled. We have studies on their outcomes that show that they're absolutely excellent. And yet they're legal, licensed, and regulated in only 36 states. We need to get them legal, licensed, and regulated in the other 4 states. There need to be many more of them. And these certified nurse midwives who practice out of hospitals should also be supported.
Gerard, what can be done within nursing to shift from a profit-driven model to an approach that's based in health and healing?
A healthy approach to nursing would actually be this. The medical professionals have this tacit social contract with the public, which I think we fulfill. That when you're ill or your loved one's ill and you come into contact with the healthcare system, we will endeavor to give you optimal care. And that's the ethos of every medical professional I've ever worked with or come across. We feel the employers of these clinicians have the same tacit social contract with us, that whilst we're doing that frontline work, which is difficult, and again, administrators, policymakers look at patients, they look at healthcare in the abstract, and healthcare is certainly not an abstract. Capitalism looks at figures and everything's abstract. We need to keep this pressure back on the healthcare industry, that these short-sighted economic decisions, that the turnover rate for administrators of hospitals in the US, average tenure right now is about 22 months. And there's a reason for that, because when you're installed as a CEO of a hospital, you've got to show a profit that quarter. There is no long-term planning currently in healthcare.
Robbie, what needs to happen in birth to really benefit women and babies?
Midwives would be attending 80% of the births. Midwives are trained in how to support and facilitate the normal physiology of birth. They tend to use fewer interventions than obstetricians. They're much more oriented towards a more humanistic approach to birth. They're kind and compassionate in their care. So in order for birth to change in a way that the planet would benefit and women would benefit, obstetricians would be reserved for those 15 to 20% of cases where their expertise in pathology is actually needed. Midwives would be attending around 80% of all births as primary caregivers. You would have to go through a midwife to get to an obstetrician. You couldn't go directly to an obstetrician. Midwives would have to refer you because you would start out with the assumption that birth is normal, and birth would become decentralized. This is a big thing of mine lately, is that, especially in the face of the coronavirus pandemic, we have seen hospitals become overwhelmed. We have seen women fleeing hospitals for birth because of the danger of contagion. We have seen home birth increase and birth in freestanding birth centers increase. but there haven't been enough community midwives for those who attend births at home or in birth centers. We haven't had enough of them to meet the demand. So a lot of women who would have liked to have given birth at home couldn't find a midwife. Usually home birth midwives take on 4 births per month. That way they give a lot of individual attention to each woman and they don't get burned out. But now they're doing up to 8 births a month, which is very challenging and difficult for them, especially when the births cluster and you don't get any sleep for days because you're going from birth to birth to birth.
Would you say more about CPMs, certified practicing midwives, and how they serve women and baby-centered births?
Make CPMs legal in the 14 states where they're still illegal. Get them all covered by Medicaid. Some of them are, some of them aren't. So a lot of marginalized women who would like to have CPM care and have out-of-hospital births can't afford to because you're a CPM in private practice. You have to make a living, right? So some CPMs work on a sliding scale and don't charge some clients very much, but they have to charge something or they can't put food on their own tables. Some of them are covered by Medicaid, but if all of them were covered by Medicaid, then they would become much more accessible to marginalized women. We especially need a lot of more CPMs of color because women of color feel more comfortable being attended by other women of color. So legalize CPMs in all 50 states, integrate them into the healthcare system. In other words, CPMs are not allowed to attend births in hospitals. Only certified nurse midwives can and obstetricians can. So we have a home hospital divide. There's the CPM in the home or freestanding birth center birth, and there's the CNM or the obstetrician in the hospital birth. CPMs should be allowed to practice in hospitals and vice versa, or they should at least be allowed to, when they have to transport a client to the hospital, which happens in 10% of the cases, then they should be allowed to go in with their client, to stay with their client, and to provide continuity of care and to catch the baby. They shouldn't be shut out as they often are. They should be fully integrated. In the 14 states where they're still illegal, CPMs they've had bills in front of their state legislatures often for a decade or more. And the American Medical Association and the American College of Obstetrics and Gynecology, or their state associations, are blocking those bills. And every state that has legislation for CPMs, the 36 states that do, it took the CPMs a good 10 years in each state to get their laws. So those laws need to be passed in the other 14 states. And if COVID taught us anything about birth, it's that care providers have to be flexible and on the ground. Hospitals got so overwhelmed with COVID patients, they weren't paying enough attention to maternity care patients. So we need this flexible, decentralized system, and we don't have enough. There are only like 3,000 practicing CPMs in the U.S. We need more midwifery training schools that train CPMs, but it's hard to fund those. It's hard to make a living doing midwifery because you have to charge a certain amount of money per student to keep your school afloat. And that's the best route to licensure, is to go through an accredited midwifery program. But those programs are expensive, and a lot of CPMs can't afford that. And they used to come just through apprenticeship, but now most states who recognize CPMs require them to graduate from these accredited programs, which are expensive. So those programs should be federally funded, and scholarships should be available, and students shouldn't have to pay for that midwifery education. They should be able to just go to midwifery school for 3 years and do their didactics and their experiential learning and graduate without having to pay a penny. If that financial backing were there for those schools, then we'd have double, tripled, quadruple the number of CPMs that we have now.
Gerard, Robbie, can we ask you to share a few final thoughts?
So this acceleration of technology in healthcare, we're certainly not Luddites. There's been a lot of expansion of technology in the last 3 decades, whereby people in ICUs now will probably recover, would have died 30 years ago. So we're not against technology per se, but we're certainly having a real issue with artificial intelligence in an effort to computerize, to robotize, to make it like a factory, really. A patient comes in, they've got syndrome A, B, C. If we do interventions, 1, 2, 3, then the result will be F, G, etc. And we find that not to be the case because people are messy. So we're railing against that. And again, we're already seeing these flaws in artificial intelligence, built-in racist bias in healthcare. So technology helps us, but the fear and the thing we're going to fight back vigorously against is artificial intelligence replacing critical thinking of human beings. So again, I really want to stress this. The whole ethos of nursing is that holistic approach, seeing the whole person and forming that relationship.
Hopeful signs are what I call the humanization of birth, what a lot of people call the humanization of birth. If you think about it, back in the 60s and early 70s, you couldn't bring your partner or your husband to your birth. You had to labor and deliver alone. So humanistic changes in recent decades have included bringing your partner and a doula. I mean, I cannot recommend highly enough having a doula with you wherever you're going to give birth, home or center hospital. Doula care has been absolutely proven to reduce length of labor, to reduce the number of interventions, including cesareans, and to produce much more positive outcomes, both physical and psychological. There are so many studies on that, and they all show the same thing. So if you're going to have whatever kind of birth you're going to have, but especially if you're going to be in the hospital, bring a doula with you. And don't go in until you're at least 6 centimeters. And your doula is not allowed to do a cervical check. That's considered a medical procedure at home, but she can tell by the way you move and by the way your body changes and by the way you're breathing. She can tell when you're in active labor and can help you go to the hospital at a time when you're already in active labor. You won't be interfered with that much. She'll keep you from going to the hospital when you're still in latent labor. So the first step for American women is to hire doulas. Doulas should be present at 100% of births wherever they take place. And that is called the doula effect. And that effect holds even if the partner is there. Like doulas have many tricks up their sleeves for supporting laboring women that partners don't have. So you may think having your partner with you would be enough, but it's not. It's the presence of the doula that shortens labor, reduces interventions, and improves outcomes. It's not the presence of the partner.
Thank you for joining us for 2 Minutes to Midnight, The Future of Work. And thanks to our guests, Gerard Brogan and Robbie Davis-Floyd. You can find the current schedule of Catalista podcasts, including 2 Minutes to Midnight, People Get Ready, and sign up to our weekly email at catalista.net. If you enjoy the show, please like, comment, and add us on Spotify and Apple Podcasts. We appreciate everyone who subscribes to Catalista on Patreon, where contributors can access merch and bonus interviews. 2 Minutes to Midnight, The Future of Work was edited and mixed by Chris Porro. Our music is composed by John Askew. The executive producers are Chicky Munch and Binny Bunny Munch, with assistance from me, Ed Goldberg, and Gerald Gerbil. This is Ed Goldberg signing off from the studios at Catalista Centrale. See you next time.